Hi, everyone. I'm Dr. Brittany Todd with Sacred Heart Clinical Pharmacy Specialties, and today I want to go over this new study that came out. It's called The Abortion Pill Harms Women. Insurance data reveals 1 in 10 patients experiences a serious adverse event. This paper came out on April 28th, 2025, so just a couple of weeks ago now, and it was written by Jamie Bryan Hall and Ryan T. Anderson, both ethicists. I think they work for the Ethics and Public Policy Center. Shaping Policy, Renewing Culture is what it says. It was published in the Life and Family Initiative. So it was a really simple study. Um, I'm going to be talking about the abortion pill. Obviously, the abortion pill harms women, is what it's called. I do want to start out by saying that I am a pro life pharmacist, but I do want to talk to all of you, all the people who may be pro choice, pro life, um, because I think this is important for everybody to know. So it was a great study. It looked at 865,727 prescriptions for mifepristone. That's a chemically induced or medically induced abortion. They use a pill and it causes the abortion. And it looked at these 865,000 prescriptions between 2017 and 2023. And the reason they found these is because they had access to an all payer insurance model. So, insurance that was part of like a in home network HMO or like the VA, where the insurance is part of their medical system. They did not look at those. These were all payer insurance models. Think like Cigna, Anthem, Blue Cross Blue Shield, United Healthcare, all of those, right? So they had access to a lot of all payer insurance models in the United States between 2017 and 2023. And right at the get go, it tells you what it found. So, out of these 865,000 plus prescriptions for mifepristone, 10.93% of the women experienced a serious adverse event. And that was defined, they looked at FDA coding for that, and it was called the Common Terminology Criteria for Adverse Events that the NIH actually does. And they grade adverse events or serious um, side effects, right? So a grade 1, grade 2, those are mild and moderate adverse events. But grade 3 is severe and grade 4 is life threatening. So if they had a severe or life threatening serious adverse event, it was included. Grade 5 is death, and that's hard to get through an all payer insurance model because it's coded differently. So they did not report death, which means there's probably more to it than we can actually find. They only reported the severe adverse events. And they found 10.93, so almost 11% of women who got mifepristone had a serious adverse event. Now, what does that mean? So, a serious adverse event was either sepsis, which is a blood infection that requires hospitalization, or another infection, or transfusion of blood. Maybe they were bleeding and they needed a transfusion, a hemorrhage, which is a major bleed, hospitalization, and it specifically said related to the abortion. So not just hospitalization. I mean, they could have broken their leg 3 days later, and that would lead to a hospitalization too if it's bad enough, right? But no, it said specifically related to abortion. ER visit, again, specifically related to the abortion. Ectopic pregnancy, other life threatening adverse events. So that could have included a cardiac, pulmonary, thrombosis, so clotting, anaphylaxis, or surgery. They included repeated surgical abortions. So, say they had a chemical abortion and ended up having to go in for a surgical abortion. And then they also had a category of other abortion specific complications. So, altogether, whether the woman had sepsis or thrombosis or hemorrhage, and some of the women had more than one. Some had a hemorrhage and needed a transfusion, or right? So sometimes they were counted twice. When they adjusted for the number of women instead of every single event that happened, they found that 11% of women had a serious adverse event, which means there were more than 11% of the adverse events. It's just they had to, if someone had two or three or five, they only counted them as one person. So it was only one leading into that 11%, if that makes sense. Let me give you an idea of how many people had specific ones. So the big ones were infection, 11,707 women, so about 1.34% of women had an infection. 28,658, which is 3.31% of women, were hospitalized because of the abortion. 40,960 went to the ER related to an abortion. So that was 4.73%. I'm sorry, I misread the line. The 28,658, or the 3.31%, was hemorrhage. So they had a bleed, not necessarily hospitalized. Hospitalization was 5,699. So my guess is a lot of those hemorrhages, the 28,000, went to the ED, or the emergency room, because that one had almost 41,000 women went to the emergency room. Almost 5% of women who had a chemical abortion went to the emergency room. That's insane. About 24,500, so 2.84% of people who took mifepristone, had to have a surgical abortion after they tried the chemical and it didn't work. And then other abortion specific complications, that was 49,169 women. So about 5.7% of women had other serious abortion specific complications. So total, there were 94,605 adverse events. Now, again, some of those could have been coded as one woman had, 3. But when they adjusted, 11%, or 10.93% of women had a severe, serious adverse event, which is crazy. So one of the questions is why. So the FDA and product labeling for mifepristone actually says that a serious adverse event rate is 0.5%. So this study showed 11%, and the product labeling says it's only 0.5. So where's the discrepancy? Well, the FDA and the product labeling looks at studies from over 10 years ago, and they only looked at about 40,000 women. And remember, when you're doing clinical trials to look at safety, they're enrolling people who are lower risk, right? They're not going to enroll someone who has a higher risk of hemorrhage, who has multiple comorbidities, right? They are going to be low risk. They exclude the higher risk populations, and they are closely monitored, right? So they could give them the abortion pill, watch them, come into the clinic if you're having issues. They paid attention, right? And this was over 10 years ago. So safety standards were very different over 10 years ago. And I will tell you about these safety standards that have changed. But that's why it's only 0.5% in the trials. But in real life, you can't make this up. 865,000 prescriptions, and over 11% of them had a serious adverse event. So you can't make that up. It does not match with what the FDA and the product labeling says. And they're going to have to look at that seriously and decide, what do they do about it? Of the 865,000 mifepristone abortion prescriptions, because remember, it's just the one prescription, 566,446 women had one abortion, and 126,427 had multiple abortions. So out of the 865,000 pills, there were only 692,000 women, right? Because some of those women took mifepristone more than once because they had more than one abortion. So that's important to note too. Okay, let's talk about the change in safety. So in 2000, President Bill Clinton is the one who initially approved the use of mifepristone as a chemical abortion. It was approved in France. They kind of rushed it over here and said, in France they liked it, so let's just, because pregnancy is a life-threatening condition, we're just gonna, rush approve it. So they did in 2000. But at the time, they had safeguards that are greater than the safeguards we have now. So in 2000, it required 3 in-person visits, meaning they probably had to have ultrasounds, make sure it's not an ectopic pregnancy, have discussions with the woman about risk and benefit. In 2016, under Obama, the risk evaluation and mitigation strategy, REMS, changed the 3 in-person visits to just one in-person visit. And then in 2023, under the Biden administration, they said 0 in-person visits, which means you could do a telehealth visit. In 2000, when it was first approved in the US, the maximum gestational age was 7 weeks, meaning that the woman had to be no more than 7 weeks pregnant. And then 2016, it was changed to 10 weeks and it stayed the same. It's still the same. It's at 10 weeks. In 2000, when it was first approved, the drugs had to be prescribed by a physician only, and that stayed the same through 2016. But in 2023, under the Biden administration, they said any healthcare provider can prescribe mifepristone. I don't necessarily think that physicians are the only ones who should prescribe certain things. I'm a pharmacist. I think pharmacists are perfectly capable and trained to prescribe medications. Not, I'm pro-life, so not mifepristone. But I don't think it's always necessarily just a physician who has the capacity to do that. However, in 2023, I'm pretty sure they changed it so that like a clinic worker at the abortion facility can just ask a couple questions and then prescribe it under the, license of a physician, but the physician never actually saw the patient, right? So that was a huge change in 2023. In 2000, the mifepristone had to be dispensed from the office of the provider who saw the patient. So you had 3 visits, and in the last visit, they'd give you the pill. In 2016, they said you don't have to do that anymore. You can just get it through a mail order pharmacy. You can go pick it up at the pharmacy. So that's a big change in safety. In 2000, it required an in-office follow-up. So you had 3 office visits, you got the pill, you went home, but you had to come back to be seen again to make sure everything's okay. And in 2016, they said, you don't have to do that anymore. And the study started in 2017. So without proper follow-up, is that why serious adverse events are so high? And it's still that way today. You don't need an office follow-up. And the other thing is, in 2000, it required reporting of any serious adverse event. And in 2016, under the Obama administration, they said, you know what? You don't have to report any serious adverse event unless the woman dies. So now you don't even have to report it. There is no reporting system for mifepristone to find out serious adverse events. Now you can find it out. That's what they did by looking at all payer insurance model. They looked at the number of prescriptions prescribed, and then from that data, did the women who got those prescriptions have a code in their medical chart somewhere that said they had a hospitalization or an infusion or sorry, a transfusion or an ectopic pregnancy. So we can get the data through the insurance, but it's not required to report it to any reporting system. So they found it. So what's interesting about this is it's an ethics paper done by ethicists, it looks like, and they found major concern, right? Like 11% of women who get this pill have a serious adverse event. So they're trying to get the FDA to look seriously at this and decide, do we need to have those safety standards put back in place, or should we just pull it from the market? My argument would be pull it from the market, because pregnancy is not life-threatening the vast majority of the time. Mifepristone always kills the baby. It's always lethal for the baby. And 11% of the time, it's dangerous for the mom as well. This is just serious adverse events, by the way. What about, those more mild or moderate? I don't know what the rate for that would be. But of course, the serious is the more concerning level, right? So they do say, at the very least, the FDA needs to look at its safety standards for prescribing mifepristone. And it says at the very end, we could reconsider approval altogether. Should this even be a treatment option for women? I would argue no, but I'm pro-life. If you like this information, subscribe to my channel. I do a lot of videos on birth control, contraception, and IVF and abortion and just medicine in general. As a pharmacist, I like to educate my audience. So if you are interested, subscribe and like my channel, and I hope you have a wonderful day.